This video will explain what happens when nurses and doctors meet at the bedside of your child. These bedside meetings are called rounds. We make these rounds to see how well your child is doing and to talk about the care with you, the family. Let's see how typical family-centered rounds might be conducted.
Jesse had a virus about a month ago. It kept him away from school for 3 days.
If I could ask you to wait 1 minute, Mrs. Johnson. The rounding team will be in very soon. Our rounds are family-centered because we really feel it's important for you to be there. You can ask questions like this, see how Jesse is doing, and what the plan will be.
Good morning, Ms. Johnson. My name is Dr. Smith. I'm the pediatric intern on the team. We're going to do family-centered rounds this morning. Is it okay if the rest of the team comes in?
Sure.
All right. Let me introduce everybody. This is Dr. Post, my senior resident. Miss Cook, the medical student on the team. Joyce, our case manager. And Dr. Jones, our attending on our team.
Nice to meet you.
And you, of course, know Sarah, the nurse.
Yeah.
So how's Jesse doing today?
He seems about the same as when we went to the emergency room.
Okay. Is there anything that's worrying you?
Yes, he still has a rash and a high fever, and he seems so sick. Do you know what's wrong with him?
We have gotten some more information back about what's going on with Jesse. So if it's okay with you, I'd like to tell the rest of the team Jesse's story and why he's in the hospital. We'll go over the lab tests and what we think's going on, as well as map out the plan for the day. Is that okay?
That's fine. Do you want me to jump in with questions or just wait till later?
You know, if it's okay, if you could wait till the end, that way I can keep my train of thought. But of course, if I say anything wrong or leave something out, please interrupt me. Jesse is a 6-year-old boy who has become progressively sicker over the last week. He's had daily high fevers.
A member of the healthcare team will present the details of the patient's case to those in the room. At times, technical and medical language will be used that may be unfamiliar to you. We will explain the medical terms we use, but please ask questions if we have not explained clearly enough. If the medical story being told is not exactly correct, please point out inconsistencies or inaccuracies as the presentation concludes. Don't hesitate to speak up if the medical story is not correct. Presenting the case in front of everyone gives the team and you an opportunity to set the record straight and be sure we share the same understanding of the illness.
He has a swollen and tender lymph node on the left side of his neck. His heart has a 1 out of 6 systolic murmur. His lungs are clear, abdomen is soft, and his fingers and feet are swollen and red. Sarah, do you have anything else to add?
He did develop a fever about an hour after I gave him the Motrin this morning.
Okay. And Miss Johnson, did that story sound correct? Did I leave anything out?
I mentioned to Nurse White earlier that Jesse had a virus about a month ago.
So how do you put together his story, his physical exam and the test results?
The doctors in the room may ask each other questions or may ask you questions to clarify a few things. They will discuss with you what they think is the most likely diagnosis or go over the treatment plan with you. This is a good time for you to ask about medical terms that are unfamiliar and to ask questions about the care plan. Physicians may examine your child and ask other members of the team to examine specific parts of your child's body in order to teach them.
I really think that Jesse has a systemic inflammatory response going on. At first I was thinking it could be infectious, something like strep, but the strep test was negative. So now I'm thinking more something like Kawasaki's disease.
Now I'm confused.
Basically, children have a reaction to something that they see in terms of a virus or a germ, and it produces the symptoms that Jesse's having. We diagnose it based on the clinical symptoms that Jessie has, as well as the lab tests. It's treated with a combination of IV medication and aspirin, and typically children get better in about 1 to 2 days.
We asked the cardiology doctors to come see Jessie to do a couple of tests. One is an EKG, the other is an echo. The echo is an ultrasound of the heart to look for inflammation.
Jessie, your heart sounds fine and strong today. We're going to ask a heart doctor to come to take a picture of your heart to make sure that it looks as good as it sounds. Ms. Johnson, we're concerned about Jessie just as you are, and so we're going to be keeping a really close eye on him today. We want to be sure that we all agree that he's starting to get better, and so we'll be in and out to see him pretty frequently today. Do you have any questions about the things we've been talking about, the test, the diagnosis, or the treatment plan?
Will you be duplicating or repeating the blood work or lab tests or cultures?
You know, I think what we're going to do is see what the results of some of the tests are, and we'll reassess Jessie so we don't do any tests that are unnecessary to do, and we'll talk to you about any additional tests that we think are necessary. We don't plan on doing any extra tests at this time today.
Mrs. Johnson, I'm going to be by Jessie's bedside a lot today. You let me know if there's anything I can do to make him more comfortable. I'll be here to answer questions after the doctor's leaves, and I'll go and get you some written material as well.
Over the past 2
The healthcare team may discuss your main diagnosis and suggest other diagnoses. This does not mean the doctors don't understand. The team is trying to make sure that all possibilities and treatments are considered. You may note team members looking up information on computers or smartphones. This is also a teaching environment, so questions may be asked of members of the healthcare team in order that everyone understands the diagnosis and the plans for treatment.
So the plan for today will be to get an EKG and a cardiology consult?
Exactly.
I'll call Jessie's pediatrician and let him know what we discussed today.
Ms. Johnson, here's my card. We have a few more patients that we need to see this morning, but I'll be back with Dr. Smith and Dr. Post and answer any questions that you might have. If you want to write them down, that would be fine, but I'll be back in a little while.
Okay, great. We'll stay right here in this room and wait for you till you come back.
Right. Thank you. Nice to meet you.
You too.
Nice to meet you, Jessie.
Family-centered rounds, a team approach. By design, it surrounds you, the family, with a circle of practitioners who are dedicated to curing and caring. But family-centered rounds are just one part of our family-centered approach. Our doctors and nurses are here to help 24 hours a day. If you need us, we're just a call away.